Hey, everybody. Thanks for joining me today for Scott's Analytics Angle. I'm Scott Everett. I'm the Vice President of Healthcare Solutions with Practical Data Solutions. And today I want to talk about patient risk scoring utilizing HCCs. Now, everybody thinks that HCCs are just for VBC due to RAF scores playing a role in MSSP, P for P, PQRS, and BPCI. But even if you're just thinking of your FFS patients, if you're using MAWVs, let's start from the beginning, shall we? So HCCs are hierarchical condition categories. A lot of people think that those are just things that CMS set up for value-based care contracts and looking at reimbursement. But really what we found as we've been working more and more with clients on this, they really can be utilized to help drive superior quality in addition to higher reimbursement for all patients, not just the value-based care ones. So let me explain a little bit why. So let's talk a little bit about HCCs and what they are and what they mean. HCCs are a subset of ICD-10 codes or diagnosis codes, which have been identified by CMS as conditions which require a greater level of care. They're chronic conditions which have been identified that could potentially lead to patients having suboptimal outcomes, higher costs, things like that if we're not treating them appropriately. So all of these, there's about 86 different HCC conditions that are listed out there, and those are stratified out into about 19 different categories. And each one is assigned a risk adjustment factor or a RAF score. And what these are is just little coefficients for each condition that's out there. And if you take these RAF scores for each patient, you take a RAF score that's given for each condition that the patient has, in addition to a RAF score for their age, for their gender, for where they live, for if they're Medicaid eligible, for other factors utilizing, disease interactions and things like that, a number of different things. What you can do is each patient is assigned a risk adjustment score or a risk factor. And these can help to stratify your populations into low, moderate, and high risk patients. So if we have all of these and we set them up in it, these were set up to identify highest risk patients for highest costs. And that's what utilized for value-based reimbursement models. These value-based reimbursement models, like Medicare Advantage plans and things like that, utilize these costs to determine a benchmark for an allocated amount of care based upon, again, the patient's risk factor and where they live. And so that's how they were initially set up. But if you're utilizing these HCC scores for everybody, not just your value-based care, you can actually improve the financial performance that comes because what you're doing is you're stratifying your populations. You're identifying your highest risk patients. You're utilizing that to identify care gaps and become more proactive with these patients that require higher levels of care. Once you're doing that and you focus on their quality and you're focusing on their outcomes, you can actually improve not just the quality that your clinic is providing, but it's going to maximize your reimbursement as well. So let's talk about how we can be proactive. What do we mean by identifying care gaps? Well, as we've broken these patients up into, low, moderate, high risk patients, we can actually look at just our moderate risk and highest risk patients and see who are these patients who haven't been in during the calendar year at all. Who are patients who in prior years have been scored with particular HCCs who have not been scored with those codes in the current year or in a prior year as well. We can look at patients who don't have any upcoming appointments and haven't been seen in the last 3, 6, 9 months. We can look at patients who haven't utilized any of their wellness visits, whether it's a Medicare wellness visit, whether it's an annual physical, things like that. By looking at that, we can actually start being a little bit more proactive with how we work with and treat these patients. Now, I want to say a little bit on wellness visits while we're doing this. if you're not utilizing Medicare wellness visits, you're certainly not alone. With the clients that we've worked with, we've seen a lot that it really is an underutilized service. And we really encourage you to maximize utilizing these wellness visits for a couple of reasons. The first one is, if you're just utilizing office visits to try to identify the conditions that all of your patients have, office visits are usually patient-directed appointments that come across. And these are ones that are usually based on a single condition or a single problem, maybe two, that the patient is concerned about. Medicare wellness visits help us as providers to identify all of the conditions that the patient has, to help understand everything that needs to be worked with and treated, and can really help with the more accurate scoring of these HCCs. In addition to that, wellness visits flat out get reimbursed more than office visits. Yes, they're longer. Yes, they require a little bit more time and effort by the provider. But we've seen providers that actually limit the schedules of the number of wellness visits that they can see. And I think it puts them at a little bit of a financial disadvantage when you consider, A, you get more than you would for an office visit that may take the same amount of time, and B, if you have any value-based contracts that are utilized, you really want these wellness visits to identify everything so your patients are fully and accurately scored for all of the risk adjustment factors that are applicable to them. Now that we're using this, if we can take and score all of our patients that are out there, we really need to be communicating to our care teams, because it's going to require them to change the way that they're doing things a little bit. So they need to understand where these care gaps are coming from. They need to understand patients who have incomplete scores. They need to understand who hasn't been seen during the year. They need to understand, potential new patients that are out there. So helping them to get a better understanding of their panel is a good way to do this. Now, PDS has a dashboard of the month, and this month we've put one out. If you visit our website at pds-online.com, you can look at the dashboard of the month, and you can see what we have as the physician completion dashboard. The physician completion dashboard is a dashboard that helps providers understand their panels. You can look at individual payers if you want, or you can look at their panel as a whole and help them see the number of unique patients that they have, the number of patients with chronic conditions, the average risk score of those patients with chronic conditions. But most importantly, what it's showing them is who are these patients that we've seen during the year and been completely scored. So we look at that and we can see, obviously, if you have value-based contracts, you want to be doing these as close to the first of the year as possible, because these scores get reset annually by CMS and by the payers. So you want to get them in as early as possible, but it's showing you here are the number of patients who have come in. It'll show you the number of patients who are still outstanding. It'll look and see who you anticipate could be new patients that are out there, and it gives the provider something to shoot for based upon where they are year to date and what they need to be doing with their care team before the end of the year to try to be a little bit more proactive and get these patients in. In addition to that, there's another dashboard that's out there called the Appointment Source Report. And what this shows is the number of appointments that are more patient-directed, so ones that are coming in through patient phone calls, ones that are coming in through the patient portal that are scheduled online, et cetera, things like that. And what's more, the clinic and the care teams being proactive in getting these patients in. So looking at things like, follow-up that is scheduled while the patient's there in the clinic, looking at outreach calls to patients who haven't been in an appropriate amount of time, looking at things like that and what's scheduled that way. So you can understand where these appointments are coming from. And if you have any initiatives, you can start tracking and trending and seeing if your proactive levels are increasing to the level that you would expect them to be. Now, being proactive and working with patients, I know personally my provider is very, very good at this. My provider will reach out to me if I haven't been in a certain amount of time to make sure that I get in for all of the labs that I need, all of the particular tests that I need for the chronic conditions that I have to manage personally. And not only is this something that helps me to, as a patient, get better outcomes and keep my costs down, but it also helps the provider with my provider satisfaction, because it makes me feel like the provider cares about me as a patient and wants me to remain in a state of wellness rather than having to try to treat me just in a state of sickness when I'm coming to them. So this proactivity is not just a quality issue, it's a patient satisfier as well. I think if there's one thing that I could have you take away from this particular version of the analytics angle, it's you really should be looking at your risk scores for all of your patients. Look at their conditions, score everyone, understand your patient populations that are out there, and identify the number and types of chronic conditions that each of your providers is treating. Obviously, each chronic condition requires a different care plan. We need to make sure that we're referring out for the specialty care that they need. We need to make sure that we're getting the follow-up that they have so that they can get their labs, so that we can make sure they're in compliance with their treatment plans and their medication. We need to make sure that their medication is working appropriately for them for what they would expect, or if some tweaks are necessary. And we need to, obviously, these frequency is going to vary based upon the risk and acuity, but we need to be proactive when these patients aren't coming in. Obviously, these patients are the ones that really drive most of our visits and most of our volume. It's important to make sure we're treating all of their HCCs, that we're identifying everything, that we're scoring them appropriately. And as we do that, our patients are going to like us more. Our patients are going to keep their costs down. Our patients are going to have better outcomes. And while we're improving our own quality within the clinic, we're also going to maximize our reimbursement as well. So thank you very much for this version of Scott's Analytics Angle. We'll see you next time. Thanks.